Be talking about medication management. Jay, you've been in this field for a long time. How long have you been doing this? Give us a little.
Well, let's see. I graduated in '98, so nearly 20 years. I guess going on
Wow.
about 18 and a half now.
So you've seen the market change, the way people provide. Tell us a little about what you've seen over those 20 years in providing.
Well, most of the time, I do outpatient psychiatry,
Mhm.
so it's a lot of working with depression, a lot of anxiety, bipolar disorder, substance issues. So, there's certainly healthcare has changed quite a bit in that time, and we have seen a huge growth in the amount of people that have accessed care these days now. It used to be that, and I think it still is to a certain extent, that people have a lot of preconceptions about coming in to see a psychiatrist or a mental health provider. Am I depressed enough? Am I anxious enough? And I think what we're really starting to identify now is that people are seeing that their quality of life can really be improved if they can access the services they need, and those things are really much more available now. So.
I want to hit a stigma when it comes to medication or managing depression. A lot of people feel that it's kind of the last step, or they're failing because they now kind of have to come see you. Have you seen that in patient management?
Yeah, I think, the struggle is also that people feel like medicines are the last step, that somehow it's the last thing that they should do before they head off to the hospital, And I think it's kind of a funny thing. We're starting to see that trend, like I was talking about before, in mental health, where people are now starting to look at it like treating high blood pressure or treating diabetes or even asthma, where, medicines are part of the tools that they use in order to get better. And I think that if they can recognize that and see those things, it's kind of like glasses. Glasses don't do the job for you, they just help you do the job, right? And you can certainly take them off if you want to and not use them.
Yeah.
But if they really help you do things better, if they can help you deal with anxiety, with depression, with feeling overwhelmed, with panic issues, that can make a huge difference in your life. And I've seen that make a dramatic difference in people's lives, and it helps them come in.
So, and I love your approach, because over the years, you said you've been in it for 20 years in this field, and you have kind of a wellness approach. Tell me a little bit more about that. I love how you treat the overall person.
Yeah. One of the things that I think we've changed a lot, this has been a trend in mental health for 30, 40, 50 years, where I think we're looking at how mental health has been treated, which is the brain is somehow different than the body. That, that's depression and that is diabetes, or this is anxiety and that's hypertension or asthma or cancer. And what we're recognizing now is that the body and the brain are really one. They communicate back and forth one another. There are hormones and chemicals in the brain, and the same things are going on in the body. And so nutrition and exercise and stress and inflammatory conditions in the body, like high blood pressure and obesity and rheumatoid arthritis and smoking, those things all affect the brain. And inflammatory conditions in the brain, like depression and anxiety, schizophrenia, bipolar disorder, anger issues, those can affect the body too. So if we're not looking at that combinations of things, a lot of times we're just missing the boat.
See, when people don't understand, I think that's a great concept, because inflammatory, when we have inflammation in the body, we feel it. Joints hurt, everything hurts. But when there's inflammatory issues in the psyche, people don't realize it's a cause of everything else.
Yeah, which is an interesting thing, because
yeah.
I think what we see a lot of times is that inflammation, we assume that it's about pain,
Yes.
right? But inflammation is all sorts of things. Obesity causes inflammation in the body. High blood pressure causes inflammation in the body. Asthma, arthritis certainly causes inflammation in the body. So we think about it as far as, I got to take a Tylenol or an ibuprofen to treat my inflammation. But there's all sorts of things that are inflammatory that then causes these hormones in the body to raise up, and that can affect the brain, it can affect hormones in the brain, it can affect our sleeping patterns, and then of course downstream that affects our eating and our sleeping and our motivation to do anything else, and so it's all connected.
So let me ask you this, for the providers out there, this is becoming a rockstar provider. 360 model, I don't think you can do one without the other. They need therapy, they need management. What do you have advice for them?
Well, one of the big things that I find and is really helpful for me is when I'm talking with a therapist, and a lot of times I get referrals from therapists, it's not that I don't think that therapy in itself can help. There are some people who do really well with just lifestyle modifications, and maybe they're going through a stressor or a job change or a health issue or something in themselves or their family. And a lot of times just processing that thing and having somebody who's not involved in their immediate family or friends group to talk about, I think that can be really helpful. Sometimes though, we're dealing with kind of hitting a wall, and over again we keep on hitting the same barriers. And so if we can kind of treat that with medicines temporarily, sometimes even just for 3 to 4 months, that can help get people over the hump, and it kind of gets them into doing better with therapy and other things like that. So I mean, I kind of think of it like, having a personal trainer at the gym. I mean, in the end, you can go to the gym and you have all the tools there, but if you don't have the resources, if you don't know how to use those things, if you don't know how your body works and how to do the machines or how to do them best, you're not going to get the same benefit. At the same time, you can have the trainer but not have the machines and not get as much of a benefit.
No.
So sometimes people really do need both of those things.
Yeah, I like that analogy because it's you have to have both, and it really is whatever is best for the person. You have
Absolutely, it's very individualistic.
Yeah,
I mean, it really depends on where people are at, and it's definitely a brave new world. I think people are trying to discover what's important to them and really focusing on their quality of life. So as a therapist, I think what I would like therapists to be aware of is if they keep on hitting a wall with clients who may be receptive to taking that next level, maybe they do need extra tools. Maybe they do need other things. And that's not a sacrifice. It's not like, oh, I'm not doing a good enough job as a therapist. Oh, my client isn't getting any better. Or even the client saying, oh, well, I've been in therapy for 3 months or 4 months and I still feel like I'm kind of not moving forward. Maybe that's because there are other things neurochemically that are going on that we need to address and help them move forward in therapy too.
Yeah, and I love the analogy in the gym. I think the trainer's one, but without the nutrition plan, you can't get the results they want. And I think that's where psychiatric and therapeutic kind of meet together. Is you can push in one way, and I've seen over the years as well, is sometimes we push one way thinking we can cure everything with one thing, but we know better. Jay, I wanted to let the providers know out there, because it's great to get rock star providers. You've been doing this for 20 years, like you said. You've seen the ups and downs. So Nevada Family Psychiatry, what are you doing different out there? How can it help so people know about you? How can you help out there? What's different about you guys?
Well, I think the biggest thing about what we do at Nevada Family Psychiatry is we're really trying to focus on the whole person, on the whole body. Again, there's a big move in psychiatry about focusing on, the whole person. This is not just about, the right dose of Prozac. I mean, that's not going to help somebody. And if that is part of the treatment, it has to be just a small little piece of the pie. I tell people all the time, I said, my piece of the pie is, this big, and the rest of the pie is all sorts of stuff that they can do for themselves, But sometimes you need advice. I mean, that's why nutritionists and dietitians have jobs. It's not that people don't know what fruits and vegetables are. It's that it's hard sometimes to incorporate those things in. So what we try and do is we do laboratory work, we do a medical workup, we do a genetic workup to try and figure out who's going to respond to what medicines, maybe how people metabolize specific medicines. And we're starting to see a lot of that now being covered by many, many insurances. So it's not the position that it was in even 5 years ago, where it was really hard to get any of those tests done, genetically. But we can look at thyroid and we can look at cholesterol and all those things. There's a lot of people I see don't have primary care providers, or they don't see their primary care that often. So I kind of consider it my responsibility to say, hey, let's look at your blood pressure. I do a weight and a blood pressure and pulse and height on people every visit, see where they're at, kids and adults. Those are big, big important things. You can't be mentally healthy if you're not physically healthy. And so part of that is, weight loss issues and dietary issues and counseling on, alcohol and tobacco, and if you're using other drugs, all those things are a big part of what we do.
Yeah, there's so many moving components, and I like how you guys are addressing all of them. I think what comes to mind is we spend so much money on the body and pennies on the mind.
Yeah.
Kind of, we're always trying to fix the body, but we forget the mind's the most important piece.
Well, and the other thing is that we spend a lot of time, I think, in Western medicine focusing on quantity of life. We all want to live longer. We all want to live to 100 years old or 150 years old, right? My sense is there's very little utility in living longer if you don't live better.
Yes.
I mean, so trying to balance that out, I think, is the key. If people are in chronic pain for the last 40 years of their life and they're miserable and they're depressed and they're anxious, then there wasn't a great thing in living longer. We want to help people live better. That's the whole point, and that's really what we try and do.
Yeah, that's great. So there you have it, helping people live longer and better. So if you have any questions for Jay, reach out to him. Nevada Family Psychiatry, and you can reach out to him anytime. How can they get a hold of you?
They can reach me at nevadafamilypsychiatry.com, or they can call my office at 702-217-8030.
So there you go. Continue to be rock stars out there. If you have any questions, we're here for you. Continue to never give up on yourself and those around you. Take care, guys. We'll see you next time.